feel pain in the neck that travels to your arms or shoulders? Headaches, frequent headaches, or grinding feeling when you move your neck? Weakness in your arms and legs? Sometimes numbness in your shoulder, arms or hands? Stiffness in the neck? Trouble keeping your balance? Trouble controlling your bladder or bowels? Maybe you are suffering from cervical spondylosis. Hello, Namaste viewers. I am Dr. Nisha Kanabar from PhysioHealer, and today we are going to discuss about cervical spondylosis, its causes, risk factors, symptoms and some tips to combat the symptoms of cervical spondylosis. Cervical spondylosis is a type of degenerative disease that affects your neck. Normally, soft disc between your vertebrae, the bones in your spine, provide cushioning. With cervical spondylosis, these discs become compressed. When this happens, the cartilage that lines the vertebrae on each side of the disc where they touch can wear away. Once this protective cartilage is gone, spurs may develop on your vertebrae where they rub together. Nerves attached to your spinal cord may have less room to pass between the vertebrae on their way out of the spine. Sometimes cracks also appear on the disc, making them bulged. The bulged disc, herniated disc, can also compress the spinal cord or nerve fibers. In cervical spondylosis, loss of neck flexibility can occur due to hardening of the spinal ligaments with age. Some facts about cervical spondylosis. This condition becomes more common with age. Many, however, don't have symptoms. You may not even be aware that these changes are going on in your neck. Cervical spondylosis usually doesn't lead to disability, but sometimes these changes in the spine can cause the spinal cord or nerve roots attached to it to become compressed. This can cause your legs or hands to feel weak or clumsy. Now, what are the risk factors for this condition? The most common risk factors for cervical spondylosis is age. The condition is very much associated with the normal age-related changes in the body. Some people inherit the tendency to develop cervical spondylosis. A family history of neck pain is often a contributing factor. A previous incidence of neck injury or spinal surgery can sometimes increase the chances of developing cervical spondylosis. Moreover, emotional distress such as depression and anxiety can be a risk factor. Some occupations that demand putting extra stress on the neck, such as those with a lot of repetitive neck movements, awkward positioning of the neck, or excessive overhead work, can make people more susceptible to cervical spondylosis. Among lifestyle factors, smoking is known to significantly increase the risk of cervical spondylosis. In addition, being physically inactive or being overweight can also contribute. People with severe arthritis in other body areas are also likely to develop cervical spondylosis. Now, let's see some complications which develop due to cervical spondylosis. In some very rare cases, permanent damage or disability can occur due to too much compression of the spinal cord or nerve fibers. A person with cervical spondylosis should immediately seek medical attention if he or she experiences sudden loss of movements, sudden feeling of weakness or numbness, or loss of bladder or bowel control. Now it's time for some tips. One of the first things that you can try at home to relieve your symptoms is applying ice to the area. Ice packs can be applied to the affected area for 15 to 20 minutes at a time. Ice helps to reduce inflammation initially. Another option is over-the-counter anti-inflammatory medications. These medications may be used to help control inflammation and relieve pain, but only and only with the physician's advice. Finally, doing certain stretching, mobility and strengthening exercises for the neck and upper back can help control your symptoms. Now let's see some exercises can help to improve your posture and increase the flexibility and strength of your upper back and neck, and thereby helping to manage your cervical spondylosis symptoms. Some precautions need to be taken while doing these exercises. Be careful with the exercises. If any of the exercises increase your pain, if it is causing vertigo-like symptoms, giddiness symptoms or headaches, stop doing them and try calling your physician. First exercise is chin tuck. This exercise will activate and strengthen your deep neck cervical muscles, means front of the neck muscles. Place 2 fingers at the bottom of your chin like this. Gently tuck your chin and retract your head backwards like this. At the same time, use your fingers to keep the chin tucked in the entire time. Hold the end position for 3 to 5 seconds. Relax your neck for a moment. Let the neck come forward. Aim for 2 to 3 sets of 10 repetitions. You should feel like the back of your neck lengthening or pulling up, and there will be packing in front of your neck. Next exercise is forward neck stretch. This will stretch the back of your neck muscles, including the suboccipital muscles. Now, how to do this exercise? First, tuck your chin using 2 fingers of the hand, just like previous exercise. Place your other hand on the back of your head and apply a gentle force down as you pull your head downwards towards your chest, like this. Then, when you feel a stretch at the back of your neck, hold the position for 20 to 30 seconds. Repeat this stretch 3 times. Keep your chin tucked as you do this stretch. Next exercise is median nerve slider. This exercise will help to relieve tension on the nerves coming out of the neck as they travel down your arm. Be careful. If this exercise is causing any pain, stop doing it immediately. Now, how to perform this exercise? Begin this exercise in upright position with the shoulder slightly back and head facing forward. Using the arm in which you are having symptoms, bring your arm out to the side and palm of your hand towards your head, similar to the flex position for the bodybuilders, like this. With the opposite arm, place it on the top of your other shoulder, like this. Slowly straighten your elbow and extend your wrist and fingers facing up, like this. You should feel stretch along the inside of your arm. With the straightening the flexed elbow, slowly bring your ear towards other shoulder, opposite to the arm that is straightening. Suppose this is step 1, step 2, and then bend your head towards opposite shoulder. Continue to straighten your elbow as far as comfortable. If you begin to feel pain or numbness, return back to the starting position and only perform the exercise in a comfortable range. Repeat on the other side if you are having symptoms in the both arms. Repeat 10 to 20 times depending on your symptoms. Next exercise is doorway stretch. This is a good stretch to help open up the chest area and upper back to improve your posture. Now, how to do it? Position your elbows and hands in line with the door frame like this. Step through the door slowly until you feel a stretch. Hold this end position for 20 to 30 seconds before returning to the starting position and repeat this stretch 2 to 3 times. Now I want to share one important information to our viewers. We PhysioHealer are planning one webinar soon on headache. Now, what can be the causes of the headaches, how to combat the symptoms of headache, and what are the risk factors for the same. Now, let me remind you that one of the possible cause of the headache can be a cervical spondylosis also. So just like that, we have many possible causes due to which we feel headache. So soon we are going to send you the registration link on which you can register for the webinar, and see you soon on that webinar also. So if you have any questions or suggestions for us, you can write down in the comment section and we'll try to reply as many as we can. Thank you for watching today's video. See you soon next time. Stay tuned for that. And if you like today's post, don't forget to like, share and subscribe us.